Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, measles in the United States and what we can do to protect ourselves. Dr. David Sugarman is the incident manager for the measles response at the U.S. Centers for Disease Control and Prevention. Dr. Dan Filardo is his colleague, a medical officer at the CDC working to fight measles across the country. They joined Dr. Josh Sharfstein to talk about how 2024 is shaping up and the effort to keep the world's most infectious human virus at bay. Let's listen.
Dr. David Sugarman, Dr. Dan Filardo, thank you for joining me from the CDC to talk about measles and the situation with measles here in the United States. I'd like to start with you, Dr. Sugarman. Could you remind us all, what is measles?
Thanks, Josh. Measles is the most infectious human virus. It's really transmitted quite well between people by respiratory droplets suspended in the air. Just as an example, one person in a room with 10 unvaccinated people will infect 9 of them. Typically starts with fever and cough, conjunctivitis, and a runny nose that lasts for 2 to 4 days. And then a rash starts typically at the hairline, extends downward, covering most of the body. And it's a lot more than just a rash. On average here in the United States, 20% of measles cases are hospitalized for dehydration, diarrhea, but some also develop pneumonia and even encephalitis, which is a swelling of the brain. And internationally, measles kills over 100,000 people in 2022.
If I'm not mistaken, there's also a late complication of measles infection.
There is. So there's a subacute sclerosing panencephalitis that can occur once young children that have not received the measles vaccine are infected with the measles virus. And 7 to 10 years later, they can develop a progressive fatal neurologic condition.
So that's rare, but incredibly severe. It looks like a mild case, and then suddenly, 7 to 10 years later, something like that, it's really severe.
That's right. It starts with minor neurologic changes. It then progresses all the way to coma and death.
So measles is a serious disease, and I guess I want to turn to you, Dr. Filardo, to talk about what is the status of measles right now in the United States.
Sure. Thanks, Josh. I'll present a little bit of data that we have on our CDC's measles cases and outbreaks webpage, which we are updating right now on a weekly basis. During 2024, so far, as of May 3rd, a total of 131 measles cases have been reported by 21 different U.S. jurisdictions. We also track outbreaks at the national level, and we define an outbreak as 3 or more measles cases which are related by transmission. And so far during 2024, 8 outbreaks of 3 or more cases have been reported, and about 70% of all cases so far this year have been outbreak associated. And just to put that in a little bit of context, during all of 2023, a total of 58 measles cases were reported and 4 outbreaks.
Thank you. I wonder, Dr. Sugarman, if you might put this in even more context. Is this a lot of measles cases? It's obviously more than last year. How do you think about where we are now?
Yeah, it's not quite as big as some of our very large outbreaks, like in 2018-19, where we had over 1,000 measles cases or several hundred cases back in 2014. But it's the start of a concerning year in which we're seeing an increasing number of measles cases, a decline over the last month, which we're happy to see. But as we head into summer travel, international travel, and what's happening now with measles in Europe, with expansion in England, in particular into London, and future travel plans for Americans, there's the concern that there will be more importations, and some of those could trigger small, moderate, even larger size outbreaks. So we're cautious as we look to the year ahead.
Cautious. I want to ask this question. A measles outbreak or the measles situation in the United States, it's not exactly like the weather, like we have no control over it. What is it that makes the U.S. more fertile or less fertile for measles to create a problem? Dr. Filardo?
Yeah, the main prevention that we have for both measles cases and measles outbreaks is vaccination. And our vaccination coverage really at a national level and down to a very local level and community level really drives the risk for outbreaks within a community.
And talk to me about the measles vaccine.
Sure. So measles vaccine is available in the US as part of a combination vaccine, either MMR, which is measles, mumps, rubella, or MMRV, which includes those three viruses, as well as varicella, or what causes chickenpox. And our standard schedule in the US for children is a 2-dose schedule, with first dose given between 12 to 15 months of age, and a second dose given prior to school entry between the ages of 4 to 6 years.
And what is our goal, Dr. Sugarman, for the level of coverage that we want to see for the number of kids vaccinated and the number of people vaccinated in order to prevent the world's most transmissible virus from creating havoc here?
Our goal is really to have every child vaccinated here in the United States, but to prevent outbreaks, it needs to be at least 95% coverage. And so during the pandemic, we slid from 95% coverage to 93% coverage, and we're really hoping to make up that gap. That's over 700,000 kids that weren't immunized over that 3-year span during the pandemic.
So would it be fair to say that at CDC there's heightened caution, like you said, not just because we're having some outbreaks and cases now, but because the vaccination rate has slipped a little bit, but enough possibly to make us more vulnerable?
It is a bit of a slip. I mean, as mentioned by Dr. Filardo, the concern is really underimmunization at a local level where there's a lot of congregation of underimmunized people, and then that allows for transmission and larger outbreaks. But yes, that said, when you have a slip in coverage from 95 to 93, there's the potential that more of those underimmunized are congregating.
Got it. I think I'm understanding what you're saying, that it's not just the 95 to 93, but there might be a community where it's like 70 or 60, and that is really a dangerous situation for measles.
That's exactly right.
So I'm going to ask this question, which is why? Why do we have these pockets of under-immunization that's putting the country at risk for measles? And you mentioned one reason, which is during the pandemic, vaccination rates fell. But why was that? And what is a concern here, Dr. Filardo?
Well, I think we have this phenomenon was seen globally, that during the pandemic, a lot of routine medical services suffered. And I think our vaccination programs globally, as well as our vaccination program in the United States, did suffer as a result of the diverted attention to the pandemic. There's also been a rise in exemptions to childhood vaccinations across the board, and specifically to non-medical exemptions, meaning exemptions that are not because of a medical condition that would preclude vaccination, but really a broader set of exemptions that people and families are opting for to not receive the routine pediatric vaccinations. And so there's some recent data from CDC that in almost all jurisdictions in the United States, those exemption rates have risen recently to quite concerning levels in some jurisdictions.
Dr. Sugarman, what do you think is behind that increasing reluctance to vaccinate? And I know we don't want to overstate this because the vast majority of kids are getting vaccinated, but there's been a shift. What do you think is there?
Certainly, and it is multifactorial. During the pandemic, there was the inability to always get to clinics and receive vaccination, but also concerns around the COVID-19 vaccination may have spilled over into routine immunizations, and some of those concerns on social media. I think there's a lot of mis and disinformation about the safety of the MMR vaccine. And so I think that that's also feeding into concerns that parents may have. And I think most critically would be the mislabeled connection between MMR vaccination and autism, that across the country, and in particular some communities, there's a real concern that there is a connection between receipt of the MMR vaccine and autism that's been disproven in multiple studies. There actually is no connection. And the signs of autism can even be seen before the first dose of MMR vaccination. And so there's a real effort underway through the Know the Signs Act Early Autism campaign to have parents aware that these signs are seen before the first dose of the MMR vaccine. The reasons are many for a slip in vaccination coverage, but we're working closely with communities to try to improve the coverage rates.
You also have a lot of information online saying that measles isn't all that serious. Have you come across that as well?
There is certainly a lot online about the fact that measles being compared to chickenpox or varicella is not very serious and it's just a benign childhood ailment. It's really misinformed. As mentioned, hundreds of thousands of children die annually around the world from measles, which causes, as mentioned, potential encephalitis and viral pneumonias, but it also leads to immune suppression acutely and sets up kids for illnesses that follow that viral illness, not just in the few days that follow, but really for months or even years that follow. There can be an immune amnesia to diseases for which there was immunity, but then because it targets memory B cells that are core to the immune system, children forget these illnesses that they had developed immunity to and are very susceptible to really profound diarrhea, pneumonia, or encephalitis for bacterial and other viral causes.
So this all adds up to quite a responsibility for the CDC. Dr. Sugarman, what does CDC do to contain measles outbreaks?
So we provide a lot of support to state and local health departments that are really at the forefront of detecting measles, confirming it, and providing immediate response to include contact tracing, making sure that everyone that's been exposed is identified, and ideally getting them post-exposure prophylaxis so that we can quickly end measles outbreaks that are occurring. So we provide direct technical assistance to state and local health departments. We also do sequencing here at CDC, and there are regional labs that provide sequencing that connect measles cases that are occurring here in the US, as well as connect them with global cases. And so we ensure that there's ongoing elimination of measles that was achieved in 2000 by tracking each of these cases and seeing how they're connected to make sure we're not having circulation for more than a year.
So you are supporting state and local health departments in the response to measles outbreaks. Dr. Falardo, what is CDC working on to boost confidence in a safe and effective vaccine that's necessary to keep measles from running wild?
Well, I think at every opportunity we get, we try to provide messaging about the safety of MMR and really encouraging people to receive their routine vaccination. And we work with health departments and our medical partners, as well as providing information to the general public about vaccination. We also have some ongoing work with specific jurisdictions within the US to work with about how to best provide messaging to communities that are wary of MMR vaccination about the safety and how to provide that messaging specifically to that community to try to boost vaccination rates to prevent cases and outbreaks within those communities.
Thank you. And Dr. Sugarman, if you could give a message to people who are listening maybe and are worried about measles, either for themselves or for their children or grandchildren, what would that be?
I would recommend getting up to date with the measles vaccine. It's safe and effective, and not just for you and your family, but for all those that are not able to get the vaccine because they're too young, they're less than a year of age when you get your first dose. Or it could be someone that's immune suppressed and had a dose, but it's no longer as effective, or they've had a medical contraindication for which they've not been able to receive live vaccines, including MMR. And then also, if they're traveling internationally, that it's critical that they vaccinate their family. And it's a bit unique with international travel. It includes infants 6 to 11 months of age should get a dose, as well as all those people traveling internationally that may not have had a second dose yet because they were born a few decades ago before we included a second dose. So go ahead and get a second dose of vaccine a couple weeks before they travel internationally.
So people can talk to their clinicians, to their doctors, to their nurses, and double check that they're up to date, particularly if they're going to travel internationally.
Indeed.
Well, thank you both for giving this update on a really important infectious disease. Let's hope that things stay relatively quiet, but I realize that this is not entirely up to the CDC, that it really matters what people across the country are going to do to protect themselves and their communities, like you said, from a really unnecessary threat. Thank you both.
Thank you, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.